So Food for Thought was a project that was funded by PIR Innovation Fund to support carers who were looking after their loved ones impacted by an eating disorder. The aim with this was to make it very accessible, especially with Queensland being a large state with rural and remote areas. So we looked at a website that was easy enough to use so that anyone, carers or even GPs, could access that and find easily explained non-medical jargon around eating disorders. And we found that the impact has been quite diverse. Obviously parents, carers, teachers, guidance counsellors, school will access that website easily and was able to download information that gave them direction to how an assessment is done, how to approach a GP, what language to use, what questions to ask, because often GPs might not know the early presentations of an eating disorder. So we have downloadable PDFs about initial assessments, questions carers could ask of their loved ones, and also downloadable information from other websites like the NEDC and Butterfly to give them accurate knowledge of what does anorexia nervosa look like, what does bulimia look like, how do we present with people who has an initial disordered eating. We found that big organizations like the Butterfly Foundation has used that kit in their Mayday big campaigns that they use. GPs, although it's a carer kit, are very reliant on that information because it is a mental health condition with the highest mortality rate. So it's really, really scary for carers to support their loved ones. And we were hoping that this easy put together kit could alleviate some of those fears. And that's definitely the feedback we've been getting. Dispelling some of the myths around eating disorders, and especially for carers who often blame themselves. So this is not a mental health issue caused by the mother or by the extended family. Yes, there are contributing factors, but we try and dispel some of those myths, ease some of those fears, and create hope. The carer kit is the start. Once you're in there reading, you get resources and you know who to connect with, whether it's Eating Disorders Queensland, whether it's QEDS when you've just left hospital, whether it is getting a psychiatrist to assess you through hospital, and also just to have a social support group where you can speak to like-minded carers. So to us it's a starting point, a really easy, accessible, non-threatening starting point, and I think that's a huge outcome is if that's the only thing we've done. I think the key learnings for us is the ever-changing nature of the illness, of the sector. It takes extra input, extra resources for us to keep updating that information. It's an established kit with really good foundations, but to make sure we involve our universities that can send us students that can help with ongoing research and keep updating that, that alleviate some of that cost or the resources that we need to use. It's a complex disease, so we can't always capture everything on a couple of pages on a website, and that's an ongoing learning for us. The question is, how do we support our carers who are looking after loved ones with a severe and enduring eating disorder? Because that's that long-term economic impact, not just on the family, but on the community and the larger economic environment we're living in. So it's always looking at that. Is that federal funding? Is that state funding? Is there initiatives around that? And that's a really big question for all of us. How do we better support carers who has to take significant time off from their day-to-day jobs? I think the small bits of work that all of us have done in the eating disorder sector has really contributed to big wins on a larger scale, like a new Medicare rebated number for people with eating disorders. And that's really going to impact not just the loved one or the individual struggling with an eating disorder, but the carers, because the financial cost is huge for carers. So having a designated rebated item under Medicare is really going to impact positively for carers and their loved ones.